membuka cakrawala. Semua bertaut udara di gelombang semesta. Kita Indonesia, sesungguhnya langit aspirasi bangsa. Kita Indonesia, sesungguhnya kita hadir bagi dunia. Kita Indonesia. Gaya budaya alam katulistiwa. Kita kabarkan berita, membuka cakrawala. Semua bertaut udara di gelombang semesta. Kita Indonesia, sesungguhnya langit aspirasi bangsa. Kita Indonesia, sesungguhnya kita hadir bagi dunia. Kita Indonesia, sesungguhnya langit aspirasi bangsa. Kita Indonesia, sesungguhnya kita hadir bagi dunia. Kita Indonesia, sesungguhnya langit aspirasi bangsa. Kita Indonesia, sesungguhnya kita hadir bagi dunia. Kita Indonesia, sesungguhnya.
Voice of Indonesia.
Listener, regarding the Nipah virus infection, the latest one was in Bangladesh, which the World Health Organization reported out on February 6, 2026. They explained that there are several patients in Bangladesh that got symptoms on January 21st, and then on the 29th of January it was confirmed that it was Nipah. It means that it's still there and it's still a concern for several nations who are increasing the not only security but also check to or the screening towards the Nipah virus, especially the entryway to their country. And to talk about how important the prevention of Nipah is and also what kind of action we need to take, has been joining us by Zoom is a national professional officer from the World Health Organization, Endang Wulandari. Good morning, Endang.
Good morning. Can't you hear me?
Yes, I can hear you very, very clearly. And I think I would like to start from the basic questions that people might have missed amid a lot of information nowadays. And the first one is that how do the Nipah virus spread across humans and everything?
Yes. First of all, thank you for inviting WHO to this important sharing. I hope this information can also add information from WHO to healthcare workers and other community. So regarding your questions about how is this virus spread, actually, these fruit bats are the natural host for the virus. And Nipah virus infections is a zoonotic disease transmission. So it can be transmitted to human through infected animals such as bats or food contaminated with saliva and urine and excreta of infected animals, including bats. So it can be also transmitted directly from person to person through close contact with an infected person. It can spread when infected bat contaminate animals, fruits, or raw dead palm sap. People may become infected if they touch sick or dead animals without protection or drink raw dead palm sap that has been contaminated with a bat or the virus, or though it is rare, maybe the people can also have transmission if they have direct contact with bats. So as you can hear just now, that fruit can also carry the virus if they have been contaminated by bat saliva or urine. So in the previous outbreak, the virus also spread from animals such as pig to humans or cattle, especially when people handled sick or dead animal or came into contact with their body fluids. So this virus can also spread from person to person through close contact with the infected persons. Therefore, the prevention is very crucial in these things to prevent the transmission. I think when the people already know the transmission route of this, so they can understand how to avoid the transmission from animal to human,
Okay,
including bats to human.
okay.
Thank
And that has been about the animal to human, and you also said about the close contact between people to people. I would like to dig deeper about it. Is it also like where when during the COVID-19 we cannot get close because it is airborne? But what about in Nipah virus case? Is it still related to saliva or something like that?
Yes, secondary human transmission or contact, human to human transmission occur through direct contact with the body fluids, for example, blood or secretion or other body fluids of infected person. So usually the transmission high among the caregivers who providing a direct patient care. Therefore, the healthcare workers are urged to use the proper personal protective equipment for treatment of the people that is infected with the virus. So it's the droplet contact. Airborne transmission can be occur if the healthcare worker perform the airborne related procedures that can create the airborne. So it is usually the transmission among people is between contact with the body fluids. And in the previous outbreaks, it is reported among the caregivers and healthcare workers without proper personal protective equipment.
And when people contracted the virus or they are carrying the virus, how long until it show a symptom, and how long can the virus stay in someone's body and so that they can spread it to other people?
Yes, the incubation periods is vary around 4 to 14 days, but in some cases, even though it's rare, there is a case with the incubation period up to 45 days reported. But during that incubation period, the people usually not symptomatic. And when they do symptomatic, for example, the manifestation of the symptom at the earlier phase of the disease is really not really specific. So people initially develop symptoms such as fever, headache, or myalgia, and vomiting and sore throat. And then it can be followed by dizziness or drowsiness or altered consciousness or maybe neurological sign that indicate acute encephalitis. Some people can experience a typical pneumonia, for example, with cough and severe respiratory problem, including acute respiratory distress. So when the people, for example, cough, so they can also infect other people with the close contact without personal protective equipment. But if the healthcare worker use the proper protective equipment for overall universal infection prevention control, droplet precautions, and contact precaution. So it will be can prevent the transmission from the infected people.
So basically, we can also learn again from the previous pandemic, the COVID-19, in which we implement the so-called health protocol, although maybe not as extreme, but that is the best practice that we can do every day to stay healthy. And then we know that the incubation period was 4 to 14 days, or in some cases it's 45 days. And when should a person be worried that they catch the Nipah itself? I mean, the symptom was quite common, right? When they can finally ask the doctor to test them for Nipah virus.
Yes, I hope the people aware about how the virus, Nipah virus, transmit from the animal bath or the other animals, as well as the contaminated food, for example, raw dead palm sap or the fruits that already eaten by the bats, for example. Then those are the risk factors that people should aware. So if the people has the risk, those risk factors during the incubation periods, so they have also developed the symptoms, for example, or maybe some people can have contact with other person which has the Nipah virus symptoms and risk factors, and they themselves develop the symptoms, so they have to go to the healthcare workers for a further diagnostic and anamnesis. So the healthcare worker can conduct the case management and investigation of this case. So in this Nipah virus, the case fatality rate is depending on the local capacities of early detection and clinical management. As early as we can treat a person with the supportive treatment, proper supportive treatment, it can improve the survival and save lives.
And about the treatment itself, it is quite complicated, or is it available in every nations?
Yes. Yeah, actually, the licensed medicines or the licensed specific vaccine is not available actually currently for the Nipah virus, but it has already included in the acceleration of medical countermeasure to respond to epidemic and pandemic as part of WHO research and development blueprint for epidemics. So in the absence of the specific licensed medicines and vaccines, the prevention of transmission is a key to prevent the transmission, further transmission, as well as the early detection and early prompt treatment is key also to improve the survival. So the case management itself, it is supportive care is recommended to treat the patient of Nipah virus, whether it is oxygenation or rehydration, careful rehydration, monitoring of the patients. So it is supportive medications that we can we can do for this Nipah virus patient.
And if we are taking a look into the quite similarities between the COVID-19 and also the Nipah virus, is that some people, Nipah is confirmed that it's mostly coming from fruit bats, the infected ones, but COVID-19 is allegedly from bats. And a lot of people are thinking that bats are categorized as an extreme or unusual menu, but we can see that the world is so diverse and it can go into the cultural context. So even if these people, based on their culture, need to consume fruit bats or maybe several other food, what is the best practice that we can do to make sure that we can still consume the bat or maybe some other food safely?
Yes. So, as you can, as you already know, what are the risk factor? So, for reducing the transmission of this Nipah virus, we have to reduce the risk of bat to human transmission and reducing the risk human to human transmission and controlling infection in healthcare setting. For example, your questions for reducing the risk of a bat, whether it's direct or indirectly to human transmission, we have to, for example, for date palm sap and other fresh product, we have to boil it first. So we should not drink the raw dead palm sap or other fresh fruits. And freshly collected dead palm juice, it should be processed properly and boiled. And the bat can also contaminate the fruits by eating some of the fruits. So the fruits should be thoroughly washed and peeled before consumption. Fruit with signs of bat bites should be discharged. Areas where bats are known to roast should be avoided also.
And talking about the fruits that has been bitten by bats, I think that if people are buying it in the market, we cannot find it, but it's about people having their trees around the home. Maybe that is one of the example where some people are consuming fruits that has been bitten by the bats. And as we can conclude from this talk is that the best way to reduce the risk is that we need to do early detection. We need to be aware what we are consuming, and also especially when there are symptoms. So when you have symptoms, you remember again what the risk factor you have got, and just go to the medical workers to get detection as early as possible. Okay, thank you very much, Bu Endang, for joining us in the Voice of Indonesia. Have a good day.
Thank you.
Okay, listener, that is the National Professional Officer of the World Health Organization, Endang Wulandari. And you can listen again to this talk on voanews.id or at our YouTube channel, VOI Official.
Voice of Indonesia. Voice of Indonesia.
Listener, today's music corner presents a song by Jemimah Cita. Juanita Jemimah Cita, better known as Jemimah Cita,